Hi, welcome to Fast Intelligent Care. In today's episode, we'll be talking about how to choose between gantries, ceiling hoists, and mobile floor hoists. So why does hoist selection matter? So we want to make sure that we are choosing the right hoist for the person, environment, occupation. So when we talk about the person, we want to make sure that it is a hoist that is going to be safe for the client. So example could be if we have a client that has unpredictable movement or anxious, we might want to make sure that we're using a hoist that doesn't have parts that we can make contact with. If we look at the environment, we want to look at a hoist that will not take up too much space, won't make the environment unsafe for caregivers. So this is an example of where we would maybe look at a ceiling hoist that doesn't take up any floor space, because maybe the client has a bunch of other equipment that needs to go in the room. And then when we look at the occupation, we look at maybe the type of transfer that the client's doing. So if we have a client that frequently somehow ends up on the floor and we need to be able to do a floor hoist, we need to make sure that we are then looking at a hoist that can do a floor lift, and then potentially can do that in a lot of different rooms. So if we just had a ceiling hoist, we might have a bit of an issue if the client ends up on the floor in the living room. We need to still be able to do a floor lift. So that's where we might want to have a mobile hoist. And then we want to make sure that we are using equipment that our carers are confident to use and familiar with and trained to use. And then we want to make sure that we are maintaining the client's dignity and also preventing injuries and discomfort. So let's look at our three main types of hoists when we're looking at passive hoisting. So hoisting for clients that don't have weight bearing ability. So we can look at a mobile or a floor hoist. We can look at a ceiling or fixed hoist, and then we can look at a gantry portable system. So when we look at a mobile or floor hoist, we're looking at something that is portable, doesn't require any installation. It doesn't have a large footprint, but it does still have a footprint. So this is something that is going to take up some space within the client's environment, so within their room, for example, because we do have that leg spread that needs to open up to make the transfer more stable. It needs to be able to go around or underneath equipment. So that's something we need to be aware of. And we need to have sufficient turning space to be able to maneuver it without making contact with any objects. It could be harder to push on certain surfaces. So if you think of carpet, for example, it could be really difficult to actually maneuver the hoist if it's a floor hoist. So when we're looking at what are the types of clients or scenarios where a floor hoist would be best suited, it could be for short-term needs. So it could be during recovery. It could be someone who is in palliative care. It could be a scenario where the client's not in their permanent home. So something like a ceiling hoist isn't realistic to install because we know that the client's going to be potentially moving to another facility or another home. It could be shared environments. So you can think of like a care facility, aged care, residential facility that will then, if they don't have ceiling tracks installed, it is useful to have a mobile hoist. Your floor hoists are also typically more likely to have ability to be compatible with a pivot frame. So a pivot frame is a type of attachment where you have clip attachments where you can actually reposition someone in sitting or lying or vice versa while they're in the sling, which makes manual handling a lot easier for caregivers. So this is something that's typically more compatible with floor hoists. Not always. You do get ceiling hoists that do have pivot frames, but if someone really needs a pivot frame for maybe gradual change in position, that would be more likely to be compatible with their floor hoists. And then when we look at cost as well, your floor hoists might be a lower cost versus your ceiling or gantries. Okay, when we look at our freestanding gantry hoists, this is where we won't require any structural work. So we don't have to install anything in the ceiling. It's not going to be a permanent fixture. It's still something that can be portable. So it's great if you wanted to do maybe a trial. So it says an NDIS trial and you want to see if a ceiling hoist could be beneficial. A gadget could be a temporary way to trial if that could be a good option. It can be set up in different rooms. Great if someone is, again, not in a permanent dwelling. So it could be someone who is renting. They don't want to be not allowed to change anything in terms of installing a ceiling track. It could be because they don't have reinforced ceiling. So it could be an older home. It could be because the height of the ceiling is maybe not sufficient to support a ceiling track. That's where we might also look at something like a freestanding gantry. So a freestanding gantry hoist is where we actually have this frame where you have, depending on what type of gantry it is, could just be a single track where you have 2 poles and then a track over it. And that can then be taken down, put into a different room if you needed to. It is something that we can adjust maybe how high or how wide that gantry is. So it can be set up in, let's say, a living room as well. It will require some floor space because now you have those 2 posts or beams that have legs. So that does take up some space where your fixed ceiling track will not. It will just take up space within the ceiling, which we will use if someone is really limited in terms of space in their bedrooms, or if they're really being transferred quite often. It makes manual handling a lot easier because now we're not having to maneuver a hoist. We're not having that equipment that's adding to our manual handling risk. So with ceiling hoist, we can have a ceiling track that has a portable hoist, so one that you can kind of clip on or hook on, or you can have one that's fixed. So when you have one that's portable that you hook on, it does have a bit of a drawback in the sense that you need to take it off to go charge it. So that could be a bit of a nuisance for caregivers to have to do every time, to be lifting it up and putting it on, or someone could potentially forget to do that and it's not charged. Whereas if your fixed ones, they usually charge while they're up there because they're fixed within the ceiling, so they actually charge. So they might have like a little docking station that they charge at. So there's no risk of the hoist not being fully charged. There's no risk of it getting lost, especially if you think of if it's in a hospital or in a facility. If someone is having to take a portable hoist on and off, there is a possibility that we could lose the equipment. Whereas if it's fixed, it's always there. We know it's not going to get, there's a risk of it not being available or not being charged. So when we look at some benefits, some uses for ceiling hoists, it is going to make your transfers lower effort, more smooth. There's no floor clutter, so we're freeing up space within the bedroom. So really good for those facilities or hospitals where we are maybe limited in room space and there's a lot of other equipment and machinery that needs to be within the room. It's good for your clients that are bariatric, have very complex needs. It's something that could potentially go into multiple rooms. So you could have something like a J track, so a track that goes from the bedroom into the bathroom, or an H track as well, so you can have full access to the whole room. So with your H track, you'll have like 2 beams and then a middle beam that can move across, and then the hoist can move side to side as well. So essentially, if you had like a square bedroom, it can literally get to all points along I guess depending on where you've also installed your tracks, but you can you're more likely to get access to the full room versus just a single track. A single track, you'll just be able to go in one direction. So if you have a single track over someone's bed, you might just be able to get them out of bed into a chair. But if you have that H track, you can get from bed into a recliner chair that's maybe in a different corner of the room. You can get from bed into a wheelchair. You can get from the bed into a commode and have a bit more. You can use more space within the bedroom as well. You're not just limited to just that one track. We also can think of ceiling hoists as something that could be a bit difficult in terms of installation, because it does require, in some cases, structural installation. So you do in some cases require a reinforced ceiling to allow for a ceiling track, because we need something that can take the weight of a ceiling that can take the weight of the hoist and the track itself, as well as the client. And that's not something that's always possible. So you will have a building professional that will have to assess that. So it does complicate your prescription process, because there's now more people, more experts that need to be involved, other than if you're looking at your mobile hoists or your gantries, you don't need that. So if someone's funding is also very limited, it might be difficult to get a ceiling track implemented quickly. So if someone really needs a passive hoist very quickly, you might have a mobile floor hoist as a temporary solution until you can do the proper assessment for a ceiling track or for a gantry. So your ceiling hoists are good for long-term needs. So someone that is going to be transferred for quite a long period of time. It's not something that's temporary. If you think of someone's prognosis, you know that they're going to need this for a couple of years. It's someone who maybe has more complex transfers. So it could be someone who is being transferred and they have involuntary movements or behaviors. There is risk of them making contact with a hoist if they were using a floor hoist, for example. So when we're looking at a ceiling hoist, we're really reducing the risk of someone making contact with like the mast or the actuator of the hoist. So if someone tends to kind of swing out their legs and stuff like that, your ceiling hoist is not going to have those issues. And it does make it a lot easier to do single-handed care. So we talked a lot about single-handed care in the previous episodes, about how with single-handed care, we use equipment to sometimes replace the role of that second handler. So you could potentially look at a ceiling hoist as being, yes, it's a higher cost in terms of equipment to a floor hoist, but it could reduce cost in terms of the amount of carers. So the support ratio can be adjusted, and then it could make it easier to maximize funding. If someone has limited funding for caregivers, your ceiling hoist will help. Or if a facility has limited staff, it does help free up a bit of it will free up staff and time to be able to assist more clients if they can do single-handed care. So just have one person assisting someone with a ceiling hoist. Also really good if you have very tight spaces, small bedrooms where a mobile hoist just won't fit. So thinking of your small bedrooms, small bathrooms. And it's going to be good for those homes that are built to support that structural load. So as a recap, what is our clinical reasoning for choosing different hoists? So you choosing between your ceiling, gantry, and mobile floor hoist. So we look at the person, the environment, the occupation, as I mentioned in the beginning of the episode. So when we look at the person, we look at things like the client's tone, weight, predictability, behaviors, the level of assistance they need. When we look at the environment, we look at things like the room size, the room layout, doorway width, if they're in a rental versus an owned home, ceiling structure. When we look at the task, we look at frequency of transfers. So someone needs to be transferred very frequently, more likely to be using a ceiling hoist, or better to use a ceiling hoist. Look at the distance that they need to travel. What are the rooms that they need to have access to? If we don't have a mobile hoist, are we able to do transfers just within the bedroom and be able to take them into other rooms or other areas of the home or facility? And how will we do that if we don't have a mobile floor hoist? And are we going to require repositioning in bed? And what sling attachments or pivot frame spreader bars are we going to be using? And is that compatible with the hoist that we're looking at? So quite a few things that we need to consider. And then when we look at the caregivers or the supports, what is their skill level, their physical capacity? So if we have a carer that doesn't have the physical capacity to be maneuvering, pushing, pulling a mobile floor hoist, would something like a ceiling hoist or a gantry be easier? What is the carer's confidence level with using equipment? And is single-handed care something that we want to work towards? Is that something that we want to implement? So that might also influence our decision in terms of going for a ceiling hoist or a floor hoist or gantry. So when we look at our mobile hoists, gantries and ceiling hoists, look at the amount of effort required. Your mobile hoist is going to require more effort. Your ceiling hoist is going to require the lowest amount of effort. When we look at installation, your floor hoist is not going to require installation as well as your gantry. Your ceiling hoist will require structural installation. In terms of cost, your mobile floor hoist would be the lowest. Your ceiling hoist will be the highest. When we look at suitability for single-handed care, your mobile hoist will sometimes be suitable, but your ceiling hoist will be more likely to be suitable for single-handed care. When we look at space requirements, mobile hoists or floor hoists require the most amount of space, ceiling hoist the least amount. When we look at portability, ceiling hoists typically not portable unless you have a portable one that clicks on, but you are still restricted with where the ceiling track is. Whereas with your floor hoist, you have very high portability. You can take it within any room that allows it to go through the doorway. So let's look at which would be preferred in which situation. So mobile hoists could be shared environments, temporary setups, low budget needs. Gantry hoists, think of when you're wanting to trial equipment, rental homes, looking if single-handed care is suitable, areas where you don't have the ability to install a ceiling trap. Ceiling hoists are for long-term needs, safety, complex needs, and for single-handed care where you require minimal carer effort. So that is a breakdown of how to choose between different hoists. If you want more information, go onto our website as well as look at our blogs and our app where we have resources on how to choose the right equipment for your client, as well as how to assess your client's needs. Stay tuned for our next episode. We'll be releasing episodes every Tuesday, and our next episode will be an interview with Gemma Cook from Hospital at Home by Lynette. Thank you. See you next time.